Could your sewage, yes, your sewage, hold the secret to letting you know if COVID-19 is in your area? Medical reporter Liz Bonus shares how it might give you advance notice that the virus is in your zip code.
If you take a look back at the history of public health, it's no secret that the health or not of a neighborhood can often be seen from what gets into the sewer system.
Testing wastewater is not new. We've been doing it forever. And so the RNA, the SARS-CoV-2 RNA, is actually detectable in wastewater because we know it's to some extent excreted in the feces.
Dr. Stephen Feagins is part of a team in Ohio given a $2 million grant for wastewater testing. His team part of a pilot program to see if he could connect coronavirus in the sewer system with COVID-19 hospitalizations. The goal is to see if you can give a neighborhood advance notice that people where you live are sick with this virus.
In the Netherlands, there's some really good data that shows that they had about a week. In other words, if you look at a curve of the RNA levels of wastewater, and as it increased, about a week later you saw COVID-19 hospitalizations increase.
The rates, he says, were comparable to traditional nasal swab testing. That would give you an indicator of whether or not the virus is going up or down in the zip codes in and around where the wastewater was sampled.
He said nobody is quite sure what order this might show up in other words, whether or not you would test it and find it first in the nasal capacity and then elsewhere in the wastewater. But he said either way, it may be good to be able to pinpoint this virus with either type of testing.
As you shed virus, RNA particles in the nose, at some point, either sooner or later, you shed viral particles in the feces. Okay. It's not really known whether that's a leading or a lagging. Typically, you shed viral particles in your feces as you are recovering, as opposed to as you are, getting a virus.
Analysis of wastewater not likely, he says, to be used as the main method of testing right now, but another tool as we try and track cases overall around the country. I'm medical reporter Liz Bonus reporting.